In the case of People versus Conrad Murray, Dr. Murray is present with his counsel, Mr. Chernoff, Mr. Flanagan, and Mr. Pena. Mr. Gorgian is not present at the present time. The People are represented by Mr. Walgren and Ms. Brazil. Dr. White, once again, is on the witness stand. All 12 jurors and the alternates are present. Everybody, good morning. And to the jurors, good morning and good week. Did we win the lottery over the weekend? Oh, sorry. I'm delighted you're here. Dr. White, good morning. Do you acknowledge, sir, you're still under oath and still sworn to tell the truth?
Yes, I do.
Thank you. This will be cross-examination by the People. Mr. Walgren. Good morning.
Good morning. Thank you, Your Honor.
Thank you.
Morning, Dr. White.
Good morning, Mr. Walgren.
Doctor, you're currently retired from the actual day-to-day practice of medicine?
Yes, I retired in September of last year from my academic position and clinical practice position at the University of Texas.
And how long had you been an actual practicing anesthesiologist prior to your retirement?
Approximately 30 years.
And that was both seeing patients on a regular basis as well as academic field?
Yes, it was clinical care, teaching, and clinical research.
And Dr. White, you would agree that you're an expert in the clinical use of Propofol, correct?
I believe I am, yes.
Are you an expert in pharmacokinetic modeling and creating the computer modeling systems and things of that nature?
No, I'm not.
And oftentimes in that area, you may rely on other people, one of which would be Dr. Schaefer, correct?
Yes, I've utilized Dr. Schaefer's expertise in this area in the past, correct.
And you've published a great deal in the area of Propofol and the clinical use of Propofol, correct?
Yeah, I think over 100 papers.
Dr. Schaefer, you would agree,
Dr. White.
excuse me, Dr. White, would you agree that on June 25th, 2009, Dr. Murray deviated from the standard of care in multiple instances?
Could I ask you for a more specific question? Would you say multiple instances?
Yeah, let me clear it up.
I'm sorry.
Do you agree that there are instances where Dr. Murray deviated from the standard of care in his treatment of Michael Jackson on June 25th, 2009?
Yes, I would.
And would you agree that there are instances where Dr. Murray deviated from the standard of care in the preceding 2 months of treatment as relayed by Dr. Murray in his statement to the police?
Yes, I would.
What is your understanding from reading his interview that Dr. Murray gave to the police regarding what type of Propofol amounts were given in the 2 months preceding Michael Jackson's death?
I'm happy to answer your question, but I would like to just preface by indicating that I've had 2 extensive conversations.
Objection, non-responsive. I'm asking you about the interview Conrad Murray gave to the police.
The objection is sustained. The partial answer will be stricken. Disregard. We ask your specific question in its entirety.
Thank you. I'm asking you specifically about Dr. Murray's statement to the police that's in evidence in this trial, okay? And I want to ask you, based on that statement to the police, were you under the understanding from Dr. Murray's statements that he was giving both bolus doses as well as infusion drips to Michael Jackson nearly every night for the prior 2 months?
I think it was about 6 weeks, yes.
In Dr. Murray's statement, he says nearly every night for the prior 2 months, correct?
That's my understanding, yes.
Now, in giving, and you understand, according to Conrad Murray, that he was typically giving 50 milligram bolus doses during that 2 month period. prior to running the drip?
Yeah, my understanding is he would give 25 to 50 milligrams mixed in a 10 cc syringe with 5 cc's of lidocaine or 50 milligrams of lidocaine, and sometimes he'd give one, sometimes two injections.
So how would this setup take place based on your demonstration last week? And again, everything I'm asking you is premised on Conrad Murray's statement to the police that's in evidence in this trial. Do you understand that?
Yes, I do.
So let's assume, based on Conrad Murray's statement, that he was giving 25 to 50 milligram bolus doses followed by an infusion drip for nearly 2 months. How would that take place as far as administering the Propofol to Michael Jackson, in your opinion?
Well, again, it's based on what was in that interview. I could not discern exactly how it was actually, the drip was administered. So I would have to rely on some conversations that I've had with Mr. Murray. Dr. Murray, excuse me.
Admonish the witness to reference
It's a
only.
very specific question, Dr. White.
Okay.
The answer is stricken. Disregard the answer, and we'll have a full question and a full answer that's specific to the question.
I just said about 2 questions ago, everything I'm going to be asking you here today regarding Conrad Murray's statements is premised on what's evidence in this trial, which is his statement to the police. Do you understand that?
Yes, I do.
Okay. So is your answer then that you don't know how Conrad Murray administered the drip on prior occasions based on his statement to the police?
I don't know the exact details. Yes.
It could have been with 2 separate IV tubing lines, as described by Dr. Schaefer, correct?
I guess there are any number of possibilities.
So is that
That's
correct?
one.
Is that correct?
That's possible, yes.
Now, would you agree that in those prior 2 months, administering bolus doses of Propofol followed by a drip of Propofol throughout the night in that type of bedroom setting would be extremely dangerous?
Without careful bedside monitoring, it could be dangerous, yes.
And with complications could result in death, correct?
If the infusion was somehow became opened up widely and was not carefully controlled, certainly you could achieve a significant effect that could result in cardiorespiratory depression, yes.
Would you ever administer Propofol without having access to basic airway equipment, such as oral airway, nasal airway equipment?
I would, when you ask about basic airway, I'm glad you clarified, but I would certainly have a means of ventilating a patient like an ambu bag, not necessarily other types of airway devices, which are nice if they're available, but they're not essential. The main thing is to be able to provide assisted ventilation with a so-called bag and mask.
So would you ever administer Propofol to a patient without having airway equipment such as a bag mask available?
I would at least have a bag and mask, correct.
And I assume, have you ever administered Propofol in someone's bedroom?
No, I have not.
Have you ever heard of anyone doing that prior to this case?
No, I have not.
When you administer Propofol, in your experience, is it in a hospital-type setting where equipment and personnel are available?
Not solely in a hospital setting, most frequently, because I've been associated with university hospitals. I have administered in office and clinic-type settings, as well as diagnostic and therapeutic centers.
Okay, and I said a hospital-type setting where there's equipment and personnel available. Have you always administered it in a setting where there's the appropriate monitoring equipment, resuscitative equipment, and personnel available?
I guess I would need more specifics. I need you to specify what you mean by appropriate. I mean, that's a broad, a broad definition that I would need more specifics, because in certain settings, different type of equipment is available and different type of monitors.
When you administer Propofol, do you have available to you, either through other personnel or immediately available to you, airway equipment such as endotracheal tubes and things of that nature?
I believe I've administered in the past in an office practice where we did not have endotracheal tubes or oral airways, but as I mentioned, always at least a bag and mask so I could ventilate the patient.
What about suction apparatus? Is that part of the equipment you think would be necessary for the safe administration of Propofol?
I think it's desirable, but it's not, again, it's one of those factors that's certainly available in hospital-based settings, but there are other settings outside the hospital where it may not be available.
But that's a desirable thing to have if you're concerned about not having a patient die, correct?
Well, certainly to treat vomiting, aspiration, it's essential, but that's something that's fairly rare. And again, it would be desirable, yes.
Well, as a doctor administering these types of agents, you prepare for the worst case scenario, don't you?
I don't know what you mean by worst case scenario, but certainly you prepare to treat complications that are likely to occur or possibly to occur. I think you can't have every device available in an office setting, for example, jet ventilation, or there's some situations that arise that may not be covered in every venue in which propofol sedation is administered.
How about pulse oximetry? Is that a necessary component for the safe administration of Propofol?
I think pulse oximetry is something that's essential anytime you administer not only propofol but sedative hypnotics to produce conscious sedation, yes.
How about blood pressure monitoring?
Yes, I think a blood pressure cuff doesn't necessarily require an automated blood pressure cuff, but the ability to measure blood pressure, yes.
And how frequently should you measure the blood pressure if someone's being administered Propofol?
Again, the frequency would depend on how the propofol is being administered. If you're administering a propofol infusion, for example, we typically would measure blood pressure at 5-minute intervals. However, if you're giving intermittent boluses, small boluses of propofol for minimal sedation, for example, in a diagnostic center, you might measure blood pressure every 15 minutes.
And that would be in a diagnostic center?
Or an office practice somewhere, typically outside of a hospital.
Some type of medical setting, either a medical office, a medical diagnostic center, maybe a surgical suite, a hospital, something of that nature, correct?
Correct.
Now, when you do propofol bolus followed by an infusion, do you utilize electrocardiogram?
Typically, yes.
I mean, that's basically standard equipment, right?
Yes, it's available pretty much.
How about capnography?
I started utilizing capnography early on when we were performing infusions of propofol. It wasn't standard. It still is not utilized in all settings. Most settings outside the hospital don't utilize capnography. But I find it is useful for monitoring respiratory rate. The CO2 values that are actually obtained are not really accurate because they're obtained either at the nose or the mouth, and they're influenced by contamination by air that's coming in and being